book. It's certainly, I would say, one of the most authoritative guides on a variety of things, from the testing to the to what kind of interventions you should do. It's really based. I mean, what do you think? What would you say the three principles that this book is based on?
I think, one principle is that we do have the ability to get behind the driver's seat and play an active role in our health and our lives. And hopefully this kind of helps, the book helps underscore that, because I did it without a doctor, and I know other people who have done it too. And that's where the idea of using these things actually came from, when I was able to do it to myself. Another pillar of the book is that looking at personalized information isn't something that is only for rich people. It's what sometimes people think, that, oh, yeah, these things are too expensive, I can't do these fancy tests. Well, it may have been very expensive. Sequencing the first human genome cost what, hundreds of millions of dollars the government spent. But now you can get that for a minor fraction of that initial cost. And as time goes by and sequencing methodologies improve and things get faster to do, the cost will also go down. And so, and you don't always have to get the fanciest, most expensive test on the planet to get some very highly useful information on yourself. That's
Let's stick with this topic. If you had to select the five most important tests that you would recommend everybody should have, which tests would those be?
That's a great question. So I think the microbiome testing is pretty reasonably priced these days. And we don't know everything about the microbiome, and we don't know every function of each microbe, and none of the tests will report on everything, because I don't know how many thousands of pages that report would be. You could tell us more than anybody else, but we have definitely some better stuff than we had before. So, we can use it. Basic lab tests that people may not even think about, cholesterol, looking at more than just cholesterol, but looking at, oxidized LDL and some of the other more advanced cardiac tests. These are covered by insurance even, and the microbiome test could be a couple $100. It's not like they're thousands of dollars. Mm-hmm. Nutritional genetics, if you're interested in getting some personalized information on yourself, looking at your DNA and just focusing on nutrition, there's some good tests out there that you could do for a couple $100, $300 maybe. It's not terribly expensive, and the information that you might gain from that may be very valuable. So, that's there, because the whole genome or whole exome sequencing may give you a ton more information, but the ton more information things, those are the ones that cost a little bit more money. So you can certainly get those, but you don't have to have that kind of money in order to get some information. So that's the point on that. And CT coronary calcium score, getting a rapid chest CT to get an idea of what your calcium deposition is in your heart, is very cheap these days. I think under $100. I think I even heard somebody say that in one of the states, I think it was Texas, that the governor had even said that people could get it for free. I think under certain circumstances, maybe if you're a certain age or something like that. So I mean, it's that important that you can quickly get an idea of what your risk factors are for heart disease by seeing what that is, because you could be totally feeling healthy and fit but have calcium deposition in your heart, so you may want to know about that. And then a body composition score. I also like that also. That's probably the fifth one that I would use. And they have different kinds of scans. One of my favorites is called an AMRA scan because it's an MRI. So it's like a rapid MRI. It just takes a few minutes and it can scan your internal body for how much fat is there. And actually it can look at how much muscle content is there too, because as we get older, we know that we can have muscle wasting or sarcopenia. And if we see that maybe this is happening before you get a little bit older and you start working on that specifically, then maybe we can kind of avoid sarcopenia from happening later on. And there are people, that may say, well, I'm skinny, right? I don't know. Why would I need a body composition scan to tell me whether I have fat or not? I know I don't have fat. But that's actually a misconception also. You may have a normal or good BMI and have a high visceral adipose tissue inside, so, and there's data that suggests that the internal BMI, if you will, this visceral adipose tissue score, which can function as that, is even a better marker or indicator for heart disease, metabolic syndrome, cancer, and things like that. So, and all these tests that we just mentioned are probably under $300 total, each one. Some are less, $100, some are $200, but I don't think anything that we just talked about is greater than $300 each, and some of them may even be covered by insurance,
So
particularly like the blood tests.
if I were the patient and I went to my physician and said, Dr. Singh recommended to have these 5 tests done, would that be easy to get those tests? Could I convince my physician easily to order those tests?
I think, well, any physician could order these tests. I think it would be very easy to talk to them about cardiac markers and blood tests because everybody kind of knows about some of these things. They may not order all of the things that they could, so they could just do that. I think the CT calcium score of the heart is becoming more of a mainstream thing to do. So that would probably not be hard. The other things, the problem is that while the doctor can order it, it is not really a big deal. It's the lack of familiarity with this and how to use it and what to do with it. That is the hesitation. Mm-hmm. And that's the problem. That's why we were saying in 20 years, right? Because it may take that much time for people to understand that people want this. Why is this important? This is important because of this, and we can do this with it. Okay, so I will change my practice style to include that. That whole process doesn't happen overnight, especially if you are, as we were describing earlier, somebody who's had this beaten into you from day one, from medical school. This is how you do things. This is the algorithm of how medicine is practiced. And, looking for genetic risk is not part of that really, unless you have a known family history of something and you're looking for something particular, right? Then we talk about genetic risk. We don't talk about genetic risk for, poor methylation or for, having vitamin C deficiency, for example. We don't talk about that. But I think eventually we will, hopefully. And once more doctors become familiar with these tests and why they're important, then maybe they'll start thinking about changing the way they practice, and it will be done that way. In the meantime, the patient should probably find somebody who they can identify with that can do it for them, or perhaps broach the topic with their doctor, who they may love as it is. They just may not be familiar with what genetics is going to do for you. And, broach it in a way that is kind of more of a partnership, because, a lot of times in medicine, if somebody comes to a doctor and says, XYZ, I heard about this. If the doctor doesn't know, the knee-jerk response is, I don't know about that. I don't know if there's any science or evidence behind it, because that's not in their algorithm, because they hadn't heard of that before. Even if it is a new study that just came out in, a New England Journal, it may not be part of new management guidelines. So they easily dismiss it, not because they don't believe in it, but because they're not familiar with it. And showing that vulnerability is a sign of weakness, as a doctor who's supposed to know everything, right? But we're humans too, right? So, we have the ability to learn and change. I did it myself. I transformed the way that I practice, and other people need to do that as well. But in the meantime, if patient loves Dr. Smith and they want Dr. Smith to do the genetics because they don't want to find another doctor to get a genetic test done, then, maybe broach the topic by talking about how you would think this would be interesting and how you would like to learn more about yourself. And this is where I heard you can get a good test from. And no skin in the game for you. Don't worry. I'm not going to come after you to make sure you give me the answer to every problem. We'll work together in learning about myself, because everybody is a puzzle that we don't know where all the pieces are yet, saying something like that and kind of broaching the topic like that may help reduce the fear that the doctor has in ordering the test or allowing the test to be ordered, because they don't feel that they're going to be criticized if they don't know how to interpret it or to talk to them about it. And they will eventually learn after they do it a few times. So it'll be good for them in the long run. And so in the book, I talk a little bit about, how to get started and things like that. And hopefully these are some of the topics that, patients can come to the doctors with.
I mean, you mentioned the example of genetic testing, but there's also, the whole microbiome analysis. So most of my patients now come to my office with, a report, often 20, 25 pages long, that they get, from the company that did their stool testing, and they want to know the interpretation, what this means. And obviously, I mean, I've spent quite a bit of time studying the microbiome and trying to interpret findings, but the great majority of doctors have never done that. So I would say there's a huge mismatch now between these very sophisticated tests that people get and recommendations they get from the commercial entity that provides this test, and the knowledge of the physicians what to do with it and what to tell the patient.
And even in the integrative and functional medicine fields, the science and technology behind looking at the microbiome is rapidly evolving. But some of the providers who may be, been doing this for a long time have, developed their own algorithms in their minds, their own methodologies on how to approach things. And it's always good to continue to learn, because sometimes the test you were using back in the day is maybe not the best test anymore. And that doesn't mean that you were doing anything wrong. It means that the science has evolved and you want to be on top of science rather than falling in the back. And that's the same thing goes for conventional doctors too. I mean, if you have somebody who has severe colitis and all you know is sulfasalazine, you're not going to get very far these days, because the patient knows that there are other things you can do. So, you have to learn about the new drugs and medications. You have to learn about the new science and tests that are out there and continually be open to changing. I can't tell you how many times, over the last several years, I had tests that I liked, and then I said, no, I'm not using this one anymore. I scrutinize the test very, very highly, and science is always evolving. So the test that is the best test now may not be the best test in a year. And that doesn't mean that you were doing the wrong thing. It means that you were, doing the best at the time, and you have to pay attention to where the science is going. There's always going to be something better coming, because science is always progressing. We want science to progress, and we want something better to happen. The point of my book, Rescue Your Health, is that we don't really have to wait until something better, because if we do that, we're going to be waiting till the end of time, because there's always going to be science evolving, right? Who would have thought we'd have robots and artificial intelligence and stuff maybe 100 years ago? It would have been kind of a crazy talk. So, but, we can use the information, but let's use the best information that we have today to try to get the most information out of it so that we can help ourselves. So it can certainly be done.
So, I mean, your book certainly does an excellent job of going through, test by test, and providing very critically the evidence, supporting some things and not others. So once you've gone through that, so the next question is, what do you do with it? So is there, what interventions? There's obviously a range of integrative medicine interventions that are available. I think ranging from the obscure and almost like faith healing kind of approaches to something that has a lot of evidence behind it, and you make a big point out of it that personalization of these treatments is essential. So what's that step? So once you've gone through the list of tests and you selected and you did those 5 tests that you mentioned, what are the the interventions. I mean, let's do the same thing. Let's pick the 5 that you would say that you would most likely pick for most of your patients.
So when I look at these tests, if we order a series of tests, I like to look at them all together at the same time. In conventional practice, you order CBC, you get it back in your inbox, you send the patient the result, CBC normal, and then another test may come, and then you say this is normal, and another test is abnormal, and you're just reacting test by test. And you may not really put it all together until the patient actually comes and sees you in the office and talks to you about all of those things. And then you maybe have waited months in order to give a recommendation to somebody that may be more proper. I look at everything together at the same time because there may be one test that suggests something and another test that suggests something else, and another test that may suggest something in between. And so you have to decide as the doctor, what's important, what's the priority, frame that in the background of who the person is, where they're coming from in their life and what's going on with them and how they eat and everything else, and then give them a recommendation. That's part of the personalization also, is actually not just looking at the paper and the numbers and what the data is, but who is the person? Where are they coming from? When I have my initial evaluations, I spend like up to 90 minutes talking to them about their life from childhood all the way through present time, symptoms all the way along. So you can really fully understand who the person is. That's also a deficiency in medicine. I mean, you have a 20-minute visit, the only purpose is to solve the one problem that you're there for, and that's it. So I look at all of these things together. I spend the time to do that. So a lot of things in looking at that, and then we look at how we can optimize their lifestyle. Lifestyle factors have to always be, no matter what, at the basis of what you talk to somebody about. There are a lot of interventions that people can make lifestyle wise that can actually help with their health in general. And if they need something particular, some supplement, or they have some deficiency of something, then we try to make recommendations that might cover many bases at the same time. For example, if they have trouble sleeping and they're anxious, we could try some ashwagandha. Ashwagandha is an herb that may make you a little bit more tired, but very relaxed at the same time, and has long been used for to treat people with anxiety. So that's one thing you could do, as opposed to going to the conventional practitioner who will give you some Ambien and Xanax. So you see the difference there. So that it's the same problem but different approach. So I try to use as many of the easier approaches, I call them, as possible. If somebody needs medicine or they need something is discovered, then you give them the medicine. I mean, you want to do the right thing. Integrative medicine isn't like homeopathy. Homeopathy is just a chapter in the book of integrative medicine. It's the true integrative medicine is actually what Dr. Weil says is good medicine. That means you're using all the tools in your toolbox as possible. So if telling somebody to do some breath work and yoga and take some ashwagandha will cure their anxiety better than Zoloft and Xanax, then why not? It's such, and for the longevity of your life, those are practices that are going to be better for you in the long run, in many different ways. So these are the kind of recommendations I come up with. And really, everybody is their own puzzle. So it's hard to say exactly what you're going to tell. It's not cookbooked. That's actually the good benefit, because like we were saying in medicine early on, we're just so algorithm to think, if this then that, if this symptom then that, if this constellation of symptoms then that. And here it's like you're walking in, every patient that I see, I have no clue what's going to happen, right? And that's actually exciting for me, because everybody's different, and somebody might have one problem, somebody might not have another problem. Here's an example. Is I had a patient who came to me once with, and I'll try to be as ambiguous as possible, but to try to get the point across, but who came to me with a lung condition and been seeing really good doctors, at various different places, and just had chronic lung infections and some lung problem that was probably driving this. Was losing weight and not thriving very well, and came to see me. And we did all. She actually went for the deepest level of evaluation, including whole genome sequencing. And we discovered she had some alpha-1 antitrypsin mutation and had a cystic fibrosis mutation. And she took that information back to her lung specialist, who were very fascinated. And her treatment course changed a bit, and we came up with some integrative modalities that based on various different tests, including that might help with some of her problems. And fast forward now about a year later, so much better, able to run uphill now. And where before it was hard to even walk without getting out of breath. So really, rescue your health means that for people who may be looking for answers that they can't find. But rescue your health can also be very important for people who don't know if there are answers to find. I've heard stories of, there's one person that just came and did the health and wellness, wanted to come for health and wellness and optimize things, and went through the whole body imaging and was found to have a brain aneurysm. I mean, brain aneurysm isn't something that you might necessarily think that, oh, I'm going to have symptoms like years in advance and then I'll get it fixed when we discover it. Brain aneurysm is you're awake one day and then you could be dead the next. So, that was discovered and had emergency intervention for that. And, that was rescuing their health, right? They didn't know they had that problem. They were otherwise healthy, consider themselves a health nut, but that person's life got saved by these kind of things. So I think everybody has a different solution within these tests, but there's always going to be something for somebody to help optimize their health and life with.
Yeah, it's sort of interesting listening to you. You could almost say that this is this approach that you're promoting and practicing is kind of like a back to the future. I mean, many of our ancient healthcare systems, the traditional Chinese system, the Ayurvedic system, share many of these basic concepts that are now being rediscovered. The difference is that we now have technologies all the way to artificial intelligence that we can actually do this a lot better. And still takes 90 minutes. I use the same time frame for seeing my new patients. Still takes a long time to take in the human part that you can't replace by
can't replace that part. That's what you're right. It's Back to the Future. I remember I was actually at the UCLA mindfulness conference a few years ago, well before COVID, and I was sitting with one of my doctor friends, and I whispered to her and I said, I think this conference is basically scientifically proving the value of religion and mindfulness. Basically, this is what we, for eons, it's been said that these are important concepts, that, mindfulness and being present, and, and how beneficial prayer and different kinds of modalities may be in helping people. But now we're just scientifically proving everything that, that we've known about for thousands of years. And Back to the Future also with nutrition, all disease begins in the gut. I mean, the father of medicine, Hippocrates said that well before he probably even knew what different microbes were, or before he even knew what acromantia was, So, now we're proving that what he said was actually true.
Yeah, since you mentioned this topic, and we're getting kind of close to the end of our conversation. So obviously, one topic that I personally, have found very interesting, both in my research but also with patients, is the role of diet. I mean, what do you come down? I mean, there's clearly two views on this. One is that there's a certain diet that I usually call the default diet that we know is optimal for how we understand now the microbiome and the health of the microbiome and how that affects the immune system. And then there's the personalized view, where you say, everybody needs their own diet because. So where do you come down on that?
I think the personalized view is probably, the more pertinent one to consider, because we know there's many different kinds of microbes and people come from many different places. And so, various combinations of microbes that you might see in any individual these days may be much more differentiated than maybe they were 1,000 years ago, I would imagine. There are, I see a lot of patients that do a lot of different diet styles, and there are some people who thrive eating in a way that you would never have maybe originally recommended them to eat. And there are other people who do very poorly in what you might consider to be the optimal diet, So if you just get into that cookbook, no pun intended, mode, just like we were, don't go back to the old ways, doctor, basically, of saying, well, no, we know that this is the best for you. We know this is the best, and this is what you have to do. You're not listening to the patient then, because the patient doesn't want to be sick. The patient's gut doesn't want to have gut problems either. So listening to that is important concept, I think. So it is a personalized one. There are some very general concepts for nutrition and health that allowance for personalization in eating one way or the other, for the most part. But I think it's important to listen to the person and where they're coming from, and also be open that the diet style might change over time. I have some people who thrive doing one diet style, and then 6 months later, it doesn't work out anymore. And now they're having a problem and they have to pivot and change the diet style. You have to be open-minded to that too, because perhaps as your diet style changes, the composition of your microbes changes, and, something else happens that that you start getting a digestive symptom for. So being open to that also. That's why I don't like calling it a diet. I like call it an eating style, because your eating style may change over time, and you should be open to that. And if people say, "Oh, eating in this way is good for me," I'm more of one that would say, "Then prove it to me. Let's see what the evidence shows." Is your cholesterol okay if you're eating this kind of a diet? Are your other health parameters okay? Is your visceral adipose fat at an okay level? What are your inflammatory markers okay? Is your microbiome alpha diversity improving or getting worse over time? These are some ways that we can try to prove if we're on the right track or not. And not just follow, somebody's blog post about this kind of diet, and that's why I'm taking it. And, I feel a little bit better too, but show me that that's why this is better for you, rather than just thinking about it. So that's where you're using some science or evidence basis to make those decisions for people.
So Marvin, this has been really illuminating, even to somebody like myself, who is in the same subspecialty in gastroenterology. So I'm sure for a lot of people that listen to this, I find this also very intriguing. And for anybody who wants to really get into the nitty-gritty of this and into the specific recommendations that you make, I highly recommend to get your book or pre-order your book, even better, Rescue Your Health. I don't have a copy here that I would show, but hopefully,
I'll get you one soon.
Send me one soon, and I'll certainly promote that as well. It's been a real pleasure talking to you. I just hope in the future there will be more examples of integrative gastroenterologists like yourself, who really will contribute tremendously to the health of patients. To the true health of patients before they get sick, and that are less confused by the chatter that they find on the internet about how to achieve that. So thanks a lot for this, taking the time for this conversation, and looking forward to our next face-to-face conversation about this.
Thank you. Thanks for inviting me.